Hi, I'm John Hayes. I'm the Managing Director of the Cheshire Merseyside Cancer Alliance. PMO is it's the backbone of the organisation. It's the bit that holds the whole programme together. It's the bit that makes our governance work. It's the bit that makes sure we are deploying our resources effectively and getting the best outcomes for our patients in Cheshire and Merseyside.
So my name's Jo Trask. I am the head of the Health Inequalities team here at the Alliance. PMO when I first started was a bit negative. I think that's a fair thing to say. It felt very structured and overwhelming, and almost I wasn't sure if it was busy work. That's sort of how it felt to me. It has converted me totally. I love working in a PMO way. There are so many kind of ways that it protects you, and I think that's one of the most important things. My team love to kind of get stuff in, get hold of a template and really work through it. What that template does, it makes us think, have we covered everything? That's something that's really important to us. We always say we never thought of that, and we never thought of that until we fill in the templates based on our PMO process. So that kind of gives us a much more thorough start to finish process. And we always write our evaluation template when we're designing the project. That to me felt crazy when I started. It didn't make any sense. Now it makes the most sense. It's perfect. And one of the things that it's done that people don't think about PMO is policy. We have a fantastic patient engagement policy, and patient engagement is a high risk area. You're working with people that you need to support and protect, but we also need to support and protect the organisation. We call that a live document. When we work with people and as we go along, we make changes to that. And what's great about it is it protects us as an organisation. We take that through the PMO process, so I can feel confident that my staff's views and ideas are not just that, they've actually been verified and processed along the way.
Hi, I'm Stephen Ward, one of the senior analysts with the Cancer Alliance. Benefits of having a PMO, I think that centralised overview of all the project documentation, but also a centralised overview of all the projects going on in the Alliance, helps keep data safe and patients safe, therefore. So if they know all the projects and all the evaluations, then we can keep a track of all the data flows coming to the Alliance. Consistency is really helpful, so we know everybody's done an evaluation plan, we know everybody's doing an evaluation. They also support us. There's 20 plus clinical quality groups across the Alliance for each tumour group and area. They're all supported by BI, so we cover 5 or 6 each. PMO function manage all those, which is really helpful. I think if we didn't have a PMO, we'd be constantly scrabbling to know what the organisation was up to, constantly finding those new projects come along that we didn't know about. So having a PMO that has that overview is really helpful. And within that, I think we'd get nasty data surprises of people collecting data we don't know about that doesn't comply with information governance or has patient-sensitive data on, things like that. I think we'd also be likely to get to the end of things and people will try and evaluate projects but not have the data to do it. So having that project lifecycle overview from PMO is really incredibly helpful, and having that training that people always know up front what they should be doing, really helpful as well.
So I'm Sarah Wood, and I'm a Senior Project Manager with the Cancer Alliance working on Lower GI and the FIT programme. PMO services have been really helpful to me. I only started in the Alliance maybe 18 months ago, and the templates they have been invaluable in me in helping understand how the Alliance want paperwork and processes to be followed. In addition to that, they've been really helpful in how I escalate any issues or risks. They're always there to help, which is a really useful resource, particularly when you're new to the organisation and need to understand how things are done at the Alliance and how best to do things.
Hi, I'm Emmeline. I'm a Transformation Manager in the Cancer Alliance. I think that PMO has been really helpful, particularly when I'm picking up projects. I joined the organization sort of like less than a year ago, and it was really helpful to have all those templates just already there to tell me what I need to do, what sort of like information I need to include to get projects through the governance process, and that helped me to sort of get on my feet and get started really quickly and make sure that everything was boxed off and done in time and sort of keeping to the deadlines. Particularly the evaluation plans have been quite helpful when working with other organizations, because when you sort of reach out and say, I want to do a project with you, they'll ask you, like, what do you want to measure? And having that already in a document that's been signed off to just throw at them has been really great.
I remember in the early days of the Cancer Alliance, we didn't have a formal PMO. We had some excellent project managers who were doing running some great projects, but they were all working in slightly different ways. And as time has moved on, the projects that we run as an alliance have become much, much more complex. The size of the budgets that we're managing are much bigger. The number of people and organisations we're interacting with is much more complex as well. And as things get more complicated, the risks in terms of making sure that we deliver on time and within budget get bigger as well. So it's really important that we have a clear focus and a clear methodology in terms of how we deliver our projects and run those programs. And that's where the PMO comes in. So it ensures that we have that consistency in how we do things. It ensures that we have clear line of sight to all of our team's deliverables. And essentially that means that I can, as in my role of managing director, I can give assurance up to our board that we are using our resources effectively and achieving the outcomes that we are required to achieve.